exactly like what I say.
You'll have to stay tuned for the next episode. Hopefully, when he comes back and we put stitches, he'll have some nice jokes for us. So I have here my friend who is non-professional, but the best comedian I know that is non-professional. And he's allowed us to share with you what we do with an abscess that is inflamed. He believes that it was due to his backpack hiking while he was in the Tibet mountains and teaching martial arts to the Japanese.
Close enough. Just visiting Japan.
So here we go. Let me know if you feel anything. Do you feel anything?
No, not at all.
Okay, so you can see the reason the liquid is out is because the cyst has popped, and that's why it's usually you don't want to do surgery on that. You can do IND, which is what we're doing, incision and drainage. That's the abbreviation it stands for. And as I'm doing, it's kind of like Mount Fuji over here. You have
more like a volcano.
Right, exactly. Isn't Mount Fuji a volcano? Not active volcano, but
not active. Yeah.
So anyway, so we're just doing an opening here so that instead of rupturing, kind of like a baby, you don't want it to make its own incision and rupture incorrectly or infect inside. You allow an opening for it to come through. And now that we provided the opening, we want to do it very small because on the chest is the area that is at highest risk to leave a keloid scar. Just enough opening for this object. This is a curette. It's like a spoon with sharp ends on one end, and just using that to kind of like clean it up. And what you see here are the cystic contents that were on the inside. And I know it's less satisfying than simply pushing and seeing this fly out like a volcano spewing the lava out, but this is a more correct way of approaching the issue. Now we do try in the process, I always try to remove it permanently. Can I have the bottle? I'll send the contents. I always like to send the contents to the lab. We have Anna here handing me the specimen bottle, so we'll send it just to make sure. Have I seen cancer that is cyst? Yes, very rarely. Do I think this is it? No. If I had to bet it, I would bet, $10 million, which I don't have, that this is not, because that's how confident I am that it's not. Now giving you a little satisfaction, squeezing it. You can see the contents coming out now that we've done it. It's important that we remove the cyst wall. Not only, and you can see here the nice shiny part, that's part of the cyst wall. But because it's ruptured inside, which is why you have the inflammation and the infection there, tenderness. Was it tender? Was it kind of sensitive?
Yeah, it was sensitive.
Yeah, it's
and itchy as well.
Itchy. All right, that's unusual, but yeah, it can happen. But itching is just another sensation that your nerves send. They're a little smaller fibers than the pain sensation fibers, but they still are activated by any inflammation in the area, anything that kind of tickles them, we can say. So here we go. Let's push out more. There's more coming out. This is like a magic show. It's more and more and more. And here you can see actually the part of the tissue that's coming out. So let's make sure that we get it all out. It comes in pieces, which is the problem with this. It's a very thin-walled cyst, and that's why very commonly I see it even, we're getting it, yeah, but not fully. Why I see it very commonly recur unless it's completely excised. Some people like to leave drains inside the area. I don't do that. I never had any issues. You can stitch the incision. You can let it heal by itself. It's probably better to let it heal by itself than to stitch it, because it will continue to drain as it's healing, kind of like any wound. And if you don't let it drain and there's a lot of drainage, you'll end up stretching the area and make more of a mark. Now, as I'm cleaning it, I'm seeing that there's still cyst wall left, and you can actually see it. It's adhering to the skin surface. So I'm using the sharp end of the curette, this against it, to kind of scrape it off the wall of the dermis, which is the underlying area to the epidermis. So epi stands for above the dermis, and this is below it. So here's more. See, this is a little reddish, but this is how it is. I'm sure you can do your own surgery. You're not squeamish at all.
Yeah.
So let's. This is still a little bit left there. Trying to make sure that you feel something.
A little bit.
Okay, so the anesthesia is a little running out. Can I have some more anesthesia? which is good because then I can use the anesthesia also to wash the area. This is a little anesthesia in there. Sorry if you feel it, let me know. You feel that?
No.
Good. There. There.
No.
There.
No. A little prick maybe, but
There.
no. No.
I'll take another syringe, please. Can give me one. Okay. Give me that. Thank you. All right. So. Okay, that's fine. Just tell him to bring someone into the room.
Yeah.
You still feel that?
Not really, no.
Okay. All right. So normal pus inside, but there's still a cyst wall, so I numb the undersurface of the skin, and we can become a little more aggressive. How about now? Is it painful now?
No.
Good. Sometimes I love to. Really, I'm trying to
Doesn't want to come out.
get it all out. Well, it's really stuck to the undersurface of the skin, and I guess this is not sharp enough to
Separate it. Yeah.
Yeah, you can see it actually. Can I have a pickup, please? You can see it. Do you see the white right underneath there? It's a big pickup for a small little area, but we'll try and get it in there. Well, it's good enough. Good job, Anna, for handing it. You handed the right instrument. And we're gonna... You know that I called Anna on the weekend and asked her specifically to take care of you.
No, thank you so much.
Yeah, she's very
Thank
good.
you for
She
calling,
picked
and
up
thank
the-
you, Anna, for coming. And
And thank you for picking up my phone on the weekend. Yeah, it's not your working hours. I'm very grateful.
Yeah,
Была
luckily she.
рядом возле телефона.
What did you say?
Я была как раз в машине с телефоном.
No, it doesn't mean that you need to pick it up.
And luckily she didn't block your number.
I know. I thought you did already. After all we've been through, right? I had enough of Dr. Levit already.
Mm.
Мы не можем друг друга.
No, she cares about the patients. That's why she doesn't block. She knows that I.
More respect for you, though.
What?
Well, it's probably cares about the patients, but also respects you
I
even
hope.
more.
I hope. I respect her for sure, a lot. What I'm gonna do is actually let it sit for 2 days, and I'm going to, if you don't mind, today is what, Monday?
Yeah.
I'll see you Wednesday if you can. And what I'll see is if it looks like it's not draining anymore, then I'll put a suture, because on the chest, it's more likely to leave keloids, as we discussed. I want to make sure that there is nothing left. Sometimes you'll squeeze like in a day or two, and there'll be more coming out, because even though I think that I removed it all, including the cyst, I may be wrong. So it's a good idea to leave it open,
I see.
and then we can see what happens in 2 days. And then 2 days, I hate to hurt you again and put some anesthesia, but this way I can increase the chance of nothing coming back there.
A reoccurrence, lower the chances, right?
Right. So this way we were able to, God willing, get the entire cyst, not just clean it up, but and make you feel better, but remove it permanently and not needing a big surgery and scars. All right. So this is basically all there is. And thank you for allowing us to educate and share our community and other doctors.
Thank
who
you
are
for
trying to do
helping
that.
me out.
It's my honor and pleasure always. Stay healthy and safe. Bye.